Today's topic, apraxia. What is apraxia? Apraxia is a poorly understood neurological condition. People who have it find it difficult or impossible to make certain motor movements, even though their muscles are normal. Milder forms of apraxia are known as dyspraxia. Apraxia can occur in a number of different forms. One form is orofacial apraxia. People with orofacial apraxia are unable to voluntarily perform certain movements involving facial muscles. For instance, they may not be able to lick their lips or wink. Another form of apraxia affects a person's ability to intentionally move arms and legs. With apraxia of speech, a person finds it difficult or impossible to move their mouth and tongue to speak. This happens, even though the person has the desire to speak and the mouth and tongue muscles are physically able to form words. Are there different types of apraxia of speech? There are two forms of apraxia of speech: acquired apraxia and childhood apraxia of speech. Acquired apraxia can occur in people of all ages. Typically, though, it is found in adults. This condition causes people to lose the speech-making abilities they once possessed. Childhood apraxia of speech is a motor speech disorder. This condition is present from birth, and it affects a child's ability to form sounds and words. Children with speech apraxia often have far greater abilities to understand speech than to express themselves with spoken words. The majority of children with childhood apraxia of speech will experience significant improvement, if not complete recovery, with the correct treatment. What is the difference between apraxia of speech and aphasia? Apraxia is sometimes confused with aphasia, another communication disorder. That confusion can be complicated by the fact that the two conditions can occur together. People with apraxia and aphasia might both have difficulty expressing themselves with words. There are, though, distinct differences between the two. Aphasia describes a problem in a person's ability to understand or use words in and of themselves. This may make it hard for someone with the condition to speak, read, or write. But apraxia does not describe a problem with language comprehension. Apraxia refers to the difficulty someone has initiating and performing the movements needed to make speech. This difficulty arises despite the fact that there is no weakness in the necessary muscles. What causes apraxia of speech? Acquired apraxia results from brain damage to those areas of the brain that control the ability to speak. Conditions that may produce acquired apraxia include head trauma, stroke, or a brain tumor. Experts do not yet understand what causes childhood apraxia of speech. Some scientists believe that it results from signaling problems between the brain and the muscles used for speaking.